Hello everyone, welcome to Tech Sharmit. In this session, we are going to talk about another very important topic related to medical coding anatomy, and that is related to the anterior ventral anatomical term of direction. If you remember, in our last session, we talked about all kind of directional term that we use to denote the anatomical structures, right? So this session is in the continuation of the same, where one by one we will talk about all positions, like all anatomical terms of direction. Firstly, we will be focusing on anterior or ventral. Okay, so though they both are same, so we will try to understand like what exactly this term is, what is the definition, how it is utilized for medical coding, and also the example that we should know about the anterior and ventral. Okay, but before we proceed further with the session, I would like to recommend you to please go and check out the previously released session first, because they all are in proper sequence and sync. So if you follow it sequentially, then it would be much more easier for you to understand the ongoing topic, because for time being we are just mainly focusing on anterior and ventral, but prior to that we have already discussed many other important topics related to medical coding. And for that, you can also refer the Tech Sharmit digital course book, where you will find thousands of free sessions, and this book is available for all of you free of cost at the description box. And as I mentioned, like there are thousands of videos. You can find the particular tab for medical coding, and there you will find everything related to those medical coding topics. Okay, and in case if you want to ask any questions on that, feel free to reach out to me through my comment section of YouTube, and I'll be more than happy to answer all your questions. Clear? Alright, so let's get started and see what is anterior and ventral. So let's start from the definition itself. So here you can see the first thing is anterior means toward the front of the body. That's one simple line is enough to explain you what is anterior. Anterior means toward the front of the body. Okay, so in simple word, you can say that any structure or a body part that is closer to the front surface of the body is called anterior. Okay, any structure, doesn't matter which structure we are talking about, which body part we are talking about, if it is closer to the front surface of the body, like face, right, chest, then these all things are called the anterior. Okay, so overall conclusion is anterior means front of the body. Now, sometimes people get confused between anterior and ventral, but don't get confused. They are just a synonym of each other. Okay, both are same thing, but usually it is used in different context. I'll tell you how it is used, but don't get confused. Don't think that they are different terms. Okay, they are same term. Anterior and ventral both means same. Okay, so anterior is also called as ventral, as I mentioned. Both words mean exactly the same thing, that is toward the front. Then how it is referred differently for according to the context, that I'll show you. So first thing is term. Term is anterior, which is toward the front. So in human anatomy and medicine, we commonly use this term anterior. But if we talk about the animal anatomy and embryology, then we use the term ventral. The meaning of ventral is also same, toward the front, but let's say if we talk about any animal who four-legged animal, right? So their front is towards belly, right? And their belly is facing towards downward, right? That's why for animal anatomy we use the term ventral. In human anatomy we use the term anterior, and in animal anatomy we use the term ventral. Clear? So we can say that yes, in human anatomy the word anterior is most commonly used. In animal anatomy like dog or cat, the word ventral is more commonly used, because in four-legged animals the belly faces towards downward. Okay, that's the main reason. Okay, so in human anatomy both terms are fully accepted, like you can refer it with ventral, or maybe you can use anterior. But in case of embryology, ventral is always preferred when describing early development of the body. Okay, so this is clear. Don't get confused. They are not different term. They are same term, but used in different context. Clear? Now, as I mentioned earlier also, these all directional terms mostly comes in a pair. opposite to each other, right? There are opposite terms also. So if we talk about the opposite term of anterior, it is posterior, which also means dorsal. Okay, so posterior and dorsal means same. So the direct opposite of anterior is posterior. Anterior means front, posterior means back. Okay, so these two always work as a pair. You cannot understand one without knowing the other. Okay, for example, the chest is anterior, the back is posterior. Okay, so if we are talking about something that is towards the front of the body part or body, it is called anterior, and if we are talking about something that is towards the back of the body part, it is posterior. Although we will discuss this posterior in detail in next session, but for now just keep in mind that the opposite of anterior is posterior. Okay, all right, now I'll just quickly show you some of the sentences where we are utilizing this term anterior along with their meaning, so that you can easily relate how anterior is used. Okay, so first sentence is, the sternum is anterior to the heart, which means sternum is in the front of the heart. Clear? Then the trachea is anterior to the esophagus. Windpipe is in the front of the food pipe. Okay, the nose is anterior to the ears. Nose is the further toward the front than the ears. The patella is anterior to the femur. Kneecap is in the front of the thigh bone. The bladder is anterior to the uterus. Bladder sits in front of the uterus. Okay, then we have the biceps is anterior to the humerus. Biceps muscle is front of the upper arm bone. The frontal lobe is anterior to the parietal lobe. The frontal lobe is forward toward the front of the brain. The abdominal muscles are anterior to the intestines. The abdominal muscles are in front of the intestine. So what did you find here common? Anterior, and it always means front of something. Okay, so as I mentioned earlier also, like we always use this term with some context, right? With some structures. So you can see every time we are talking about heart, food pipe, thigh bone, uterus, right? Different thing. But the common thing is anterior, which always means the front. Okay, so this is just a common example. Now some of you might be thinking like how it is utilized in medical coding. So I'll show you some examples so that it will give you the clarity. Okay, so in medical coding, especially in ICD, TAM, CM, CPT, the word anterior appears very frequently. Okay, where? I'll show you. So here on the first column I have noted down all the medical term, and on the second column I have noted down the meaning. Okay, so one by one we'll go through it. The first term says anterior myocardial infarction, which means heart attack affecting the front wall of the heart. Okay, clear? So here anterior is denoting the front wall of the heart. Okay, second, anterior cruciate ligament, which is also known as ACL tear, right? So tear of the ligament at the front of the knee. So from the front of the knee, if the ligament is teared, then we will denote it with the term anterior cruciate ligament, which is also called as ACL tear. Okay, then we have anterior chamber of the eye. Anterior chamber of the eye means front space inside the eyeball between the cornea and iris. The next is anterior frontanel, soft spot on the front top of the baby's skull, front top. Okay, so here we are also using front. Then we have anterior horn of the spinal cord, which means front section of gray matter of spinal cord. Anterior tibial artery, which means artery running along the front of the lower leg. Then we have anterior cervical discectomy, which means surgery on the front of the neck to remove a disc. And last one example is anterior wall of vagina, which means front wall of the vagina adjacent to the bladder. So these are the all commonly used medical term, although there are lots of other terms as well. But just to explain you, I just noted down these terms. So I think now you have idea like how it is utilized in medical coding. Clear? Now we will summarize this entire session. So to summarize this thing, I have noted down few important points, so you can go through one by one. The first thing is anterior means front of the body. Ventral, same meaning as anterior. Okay. The opposite of anterior is posterior or dorsal. So these are some important interview questions. Okay. These terms always based on the anatomical position. So in the previous session I clearly mentioned that whatever terms we are going to learn is assuming that we are talking in terms of anatomical position. Okay. It is relative term, always compares one structure to another. Yes, that is also true. Then I have noted down few examples, like the sternum is the most important and anterior bony landmark of the thorax, right? The face, chest, belly and kneecaps are all classic anterior structure. Yes, because they are front towards the front. The palm faces anteriorly in anatomical position. That is true. The ACL, which is called anterior cruciate ligament, is one of the most commonly quoted uses of this term in orthopedics, right? ACL. Then we have noted down anterior is used to form compound directional whorls also. Okay, so it is also used to build the compound directional whorl like anterior-lateral, anterior-medial, anterior-posterior. Okay, so this is how we will build the compound directional whorls. Maybe we'll discuss this in detail, but for now just keep it in mind. Okay. Now, as we know, now we have idea like what is anterior and what is ventral. Now I'll just give you some tricks to learn this thing. Okay, so memory tip is A is for anterior, which means what A means. A means ahead, right? So just remind this in this way, that anterior start with A, which means ahead of something, that is front of something. Okay, so whatever you see when you look down at your own body, it's anterior. Like your chest, belly, knee, face, all are anterior, right? And whatever is behind you is called as posterior. That I'll show you in the next session, what is posterior or dorsal. Clear? So I think this part is clear to all of you. Now, as usual, I'll share you one question, and I strongly request you everyone, please do share your knowledge in the comment section for this question. Please write answer, because once you write the answer, it will indicate me that you need more sessions of this series, and accordingly I will publish more and more sessions for this series. Okay, so according to your response I will work on my work. So question is, who use anatomical terms of direction? I'm sure you already know about the answer of this question, so please do share your knowledge in the comment section. But in case if you don't know the answer, then you can refer the previous session. There I have already discussed this in detail. So from there you can take a reference, and then you can tell me what is the answer in comment section. But please make sure to put the answer in the comment section, because it will also help us to reach to the wider audience, and also it will help other students to learn the things directly from the comment section if they want to refer something as an answer. Clear? So yeah, that's all for today. See you in the next session with new topics. So thank you for watching Tech Sharmit.